Hello everyone, I am Julian Morris with the Channel 5 News. In the headlines, Prime Minister Skerrit appeals to Dominicans to follow the example as he and other cabinet members take the AstraZeneca vaccine. A $2 million project to develop resilience making significant headway, and the possibility of a geothermal power plant for Dominica by the end of next year. The details coming up.
Your old tablet? That's so 2020. Get a Samsung A7 tablet from Flow for only $99 when you sign up for a new All-In or All-In Plus bundle. Enjoy faster broadband speeds to surf and stream, more TV channels in HD to stay entertained, and unlimited flow-to-flow fixed minutes to stay in touch with everyone you love. So sign up today for a new bundle from Flow. Visit discoverflow.co for more information. Terms and conditions apply.
Strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
Prime Minister Skerrit says while it is not mandatory, he believes it's in the best interest of all citizens and that of the nation to get vaccinated. He says this is a critical step in stopping the spread of the disease. Mr. Skerrit, who took his shots on Tuesday at the Dominica-China Friendship Hospital, says there are enough vaccines to give 25,000 Dominicans a double dose of the Oxford AstraZeneca vaccine. The Prime Minister says within the next week, Dominica will receive 20,000 doses of the Chinese vaccine. Dominica will also receive vaccines from the COVAX facility administered by the Pan American Health Organization and the World Health Organization.
Let us not wait for countries to impose on us the need for us to have a vaccine to come to the country. This is going to happen. Trust me. Because when the United States gets its herd immunity, and the UK gets its herd immunity, and France and other countries, they're going to say, look, for you to come to our country, and rightly so, you need to show your vaccination card. And then all of you are going to WhatsApp me and call the Minister of Health and say, boss, look, it's Skerrit, I'm going to travel to the UK, so-and-so. I'm going to go to the US, I need a vaccine. Give me a break. Let us take a vaccine. Now, you have an opportunity to take it and to have your card. And so anytime this country is imposed these conditions on us, we'll all be vaccinated in the Commonwealth of Dominica. Let us go ahead and get vaccinated, my dear friends.
Mr. Skerrit says Dominica is fortunate and that is not to be taken lightly.
As the Secretary General of the United Nations said, more than 130 countries have not received 1 dose of the vaccines. We got 70,000. We thank God for that, and we thank the government of India for that. Let us go and take our vaccine.
Meantime, Dr. Cleona Peters says health officials are pleased that the public is accepting of the anti-coronavirus vaccine. Dominica began a new phase of vaccine implementation in the fight against the COVID-19 pandemic on Monday when the Ministry of Health began vaccination of target groups in all 7 health districts.
It looks like we may just need more vaccines at the rate at which we're going. So we're quite pleased because our aim here in public health care is to prevent the transmission of diseases, to reduce the spread basically of diseases and to reduce the deaths from diseases. So that's why vaccination, immunization is very important.
An employee of the Dominica Red Cross is encouraging others to do so.
You lead by example. This vaccine is going to assist us tremendously in the work that we're trying to do to get rid of COVID in our society. And as an employee of the Dominica Red Cross, I felt that it is important that I take the vaccine to lead by example based on my position with responsibility for COVID in our response to the pandemic. The process is very simple. You pre-register online. When you get to the registration booth, you give your name and you're taken into the health center to get your vaccine done. It's very simple. One prick, then you're done. You're waiting for 15 minutes, and that's practically what it is. It's very simple. I'm feeling normal. I'm doing okay. No side effect as yet. I'm not sure for later on, but the process is very simple. So I encourage everybody, if you can and you feel like you want to get the vaccine, come out and take the vaccine.
Vaccinations are taking place all this week until Friday from 9 to 3. Vaccination is taking place at Type 3 health centers to include Roseau, Grand Bay, St. Joseph, Castle Bruce, Marigot and Portsmouth health centers. The Permanent Secretary in the Ministry of Health told a recent ceremony at Douglas Charles Airport that the ministry had done well in collaborating with other stakeholders in the fight to mitigate the spread of COVID-19. The Permanent Secretary was among government and top health officials recently receiving a donation of 70,000 doses of the Oxford AstraZeneca vaccine from the government of India. The rollout of these vaccines to the wider Dominican public began on Monday at all 7 health districts.
Less than 1 year ago, the first positive case of COVID-19 in Dominica was announced, and the government of Dominica, through the Ministry of Health, Wellness and New Health Investment, has been sparing no effort in ensuring that all possible and effective measures are implemented in maintaining the safety of all. We have done well through collaboration with other key stakeholders, given our limited resources. But we are always reminded that there is always room for improvement, and hence the Ministry of Health, Wellness and New Health Investment, having been charged with the mandate to lead the way during the COVID-19 pandemic, has never settled for less.
The Permanent Secretary is reminding citizens that they must play their part in order to win the war against the COVID-19 pandemic and return the country to some semblance of normalcy.
In the Ministry of Health, Wellness and New Health Investment, we are confident that with this donation, coupled with the other donation expected under the COVAX facility, Dominica is well on its way to achieving 100% COVID-19 vaccine coverage. This is the target that the Ministry of Health has set. However, we are all reminded that in order to achieve this goal, each and every one of us must play our part.
Dominica should have a geothermal power plant on the ground by the end of 2022. Ambassador Vince Henderson, who coordinates the geothermal project, says it's pretty much on target.
Where we are now, we feel confident that we can deliver a geothermal power plant by December 2022. And why I think we can do this is because we are now at the stage of finalizing our negotiations with our partners. We have 5 main agreements that we've been working on since April of 2020, and our target is to complete them by March 31st, 2021. Civil works for wells will begin in May 2021. By the way, we are out already. We went out to tender since on February 6th. We went out to tender for drilling of the new wells. We also went out to tender last week for civil works that we expect to begin in May. So we're pretty much on our way. We have received the tenders for the actual construction of the power plant and its installation, and we hope to award a contract by the end of March. We are now negotiating the term sheets to finalize the terms of the contract.
Ambassador Henderson says negotiations for financing the project are at an advanced stage.
All our lenders have already submitted their term sheets. They will begin their due diligence next month, and we will do negotiations so that we can have a close sometime in May or June. So we expect the actual plant construction to start immediately after we've drilled the first well, because we'll be doing 2 wells this time. And so we really expect to see work starting in the coming months. This year, it will take 18 months to really install the power plant. And we are looking forward to getting the plant by the end of 2022.
You are watching Channel 5 News. We'll have more after this.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD. All for $160 a month with the new all-in bundle. With Flow, it only gets better. Your old tablet? That's so 2020. Get a Samsung A7 tablet from Flow for only $99 when you sign up for a new all-in or all-in plus bundle. Enjoy faster broadband speeds to surf and stream, more TV channels in HD to stay entertained, and unlimited flow-to-flow fixed minutes to stay in touch with everyone you love. So sign up today for a new bundle from Flow. Visit discoverflow.co for more information. Terms and conditions apply.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid. But there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
A just over $2 million EC project to develop resilience in the country is making significant headway. Andrea Louis explains.
The International Organization for Migration, IOM, with the financial support of the United States Agency for International Development, USAID, is spearheading the renovation of 7 emergency shelters in different communities around the country. Communications assistant with the IOM, Maxine Aline Esprit, says retrofitting and rehabilitation of the emergency shelters will be extremely useful to residents in time of disaster.
The 7 shelters that have been made available for these works are the Cochrane Old School, the Cottage Community Center, the Eggleston Pavilion, the Resource Center at Lower Penville, the Point Michel Community Center, and the Sinico Resource Center. The works that are being undertaken by IOM under this USAID project include improvements to the roof structures, the changing of doors and windows, repair of toilet facilities, installation of water storage tanks, kitchenette repairs and retrofitting, and other rehabilitative works as have been deemed necessary to ensure the safety of people who may be forced to leave their homes and take refuge at a public emergency shelter during a crisis, such as a hurricane or other natural disaster.
Work on the 7 emergency shelters is expected to be completed before the start of the 2021 Atlantic hurricane season.
IOM has engaged 3 local contractors to undertake the rehabilitative works under the supervision of a project engineer. The works are advanced, and we expect that they will be completed at 3 of the emergency shelters by the end of this month, February 2021. Works at the other 4 shelters should be completed during March and April, well in advance of the Atlantic hurricane season. The project will also provide essential emergency shelter equipment, including cots, wheelchairs, first aid kits, kitchen equipment, water tanks, and generators where necessary.
Chairperson of the Emergency Shelter Subcommittee, Glenroy Toussaint, says these repairs will help improve the emergency shelter stock in the country.
Several communities do not have the resource of a designated emergency shelter, and as a result, this project is in ensuring that these buildings are in good condition so that vulnerable people in these 7 communities have a place of refuge in the event of a disaster. We had to prioritize the emergency shelters that we would ask IOM to help us rehabilitate based on the vulnerabilities of these communities. the number of people who would be required to use the facility during adverse weather events, and importantly, the level of organization of community-based disaster management in the 7 communities.
Discussions underway to have private COVID-19 vaccinations for one of Dominica's high-risk groups. Andrea Louis tells us more.
Coordinator of the National HIV/AIDS Response Program, Lester Guy, says the people who are HIV positive or who have AIDS fall under the high-risk category of individuals as their immune system is already compromised. While not discouraging clients to visit a regular health center to get the vaccine if they so choose, Guy believes the level of confidentiality offered at a private clinic will improve the chances of people with HIV and AIDS stepping forward to receive the vaccine.
The discussion is being held. I've already spoken to the clinical care doctor who's attached to the unit. I've also need to reach out to the director of primary health care and the epidemiologist and have a discussion. And it's not really a reason of not wanting them to go to the health center. Again, persons are very concerned about confidentiality of their status. And you know, there's so many persons involved in the entire process of giving the vaccine, so they would have to have gone through so many different persons. Again, for people's level of confidentiality and feeling comfortable coming to the healthcare system, and especially when you're doing targeted interventions with persons who are vulnerable, you have to take that into consideration. So I think it would be a lot better for them. It's a lot more appropriate for them if we could do it at any given time at our clinic.
In speaking with clients of the NARP, Guy says there are mixed reactions towards being inoculated, and the main concern being the length of time with which it took to develop the vaccine.
You can understand why this concern is there, but I've always said to people, the thing about humanity is that we react to threats that's before us. So I know some people are pretty concerned about the time frame that these vaccines have been developed, but again, we do have a pandemic, an international pandemic. So we have to bear in mind that with the level of intelligence and the level of research and scientific findings that we have to do something to protect people. So I think that is one of the reasons you will find we are very reactive and putting a lot of time into developing vaccines when the entire humanity is at risk.
Guy reiterated that the decision to be vaccinated lies with the individual and encouraged the public to read and research on the vaccine to make an informed decision.
Bear in mind that it's optional. You know, nobody's forcing you to take up the vaccine. You have to make an informed decision. And what I say to most of the persons that I interact with, including my clients, make sure that you read, you inform yourself so you know what you're getting into. You know, persons like myself have already taken the vaccine. I make sure that I inform myself and see what the benefits in it and the risks that are involved in it. But from an individual point of view, I think it's something that is useful.
The deadline for receiving the first dose of the Oxford AstraZeneca vaccine is 29th March. Andrea Louis, Channel 5 News.
And strong advice to individuals on their cancer journey to confer with their healthcare provider before taking the Oxford AstraZeneca vaccine. Dominica began its national vaccination program on the 22nd February in an effort to protect the public against the coronavirus. People who fall within the high-risk categories have been encouraged to be vaccinated for their protection. President of the Dominica Cancer Society, Yvonne Alexander, says cancer patients have been advised to seek the advice of their doctors before choosing whether or not to be vaccinated against COVID-19.
While there is this group of individuals who refer to themselves as cancer survivors and may not be at this time exhibiting any signs or symptoms of cancer illnesses, there are those who are in various stages. There are those who are currently in treatment, receiving chemotherapy, which in itself affects the person's well-being. So that is why we say it's going to be a personal decision. Members of the Cancer Society and individuals affected by cancer generally have been advised to consult with their health care provider.
The Cancer Society's president says the main concern among those on their cancer journey is the possible side effects of the vaccine.
I think people are much more concerned about the effect on their health and their well-being, depending on where they are on their journey, whether they are currently affected by any other symptoms, whether they are on medication, if not chemotherapy, that kind of decision. This is the discussion at the moment is, should I be if I am, because, there are other implications in relation to where the person is on their cancer survivor journey.
Alexander urged those who have already received the COVID-19 vaccine and the wider public to keep practicing the health protocols until the country is in a place of safety.
I consider the vaccine as probably one of the options that people have. I think I still want to encourage the general public, and in particular individuals who have been affected by cancer, to continue to adhere to the protocols. I think, to me, that is even as important as the vaccine. The mask wearing, the sanitizing. That is what I would want to advise, that individuals do not let their guards down, even if you have taken the vaccine, to continue, as the Ministry of Health has advised, to adhere to all the usual protocols in relation to COVID-19 until we are really very sure that we are in a place of safety.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts, with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited Flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD, all for $160 a month with the new all-in bundle. With Flow, it only gets better. Your old tablet? That's so 2020. Get a Samsung A7 tablet from Flow for only $99 when you sign up for a new All-In or All-In Plus bundle. Enjoy faster broadband speeds to surf and stream, more TV channels in HD to stay entertained, and unlimited flow-to-flow fixed minutes to stay in touch with everyone you love. So sign up today for a new bundle from Flow. Visit discoverflow.co for more information. Terms and conditions apply.
To end the news, the headlines again. Prime Minister Skerrit appeals to Dominicans to follow the example as he and other cabinet members take the AstraZeneca vaccine. A $2 million project to develop resilience making significant headway, and the possibility of a geothermal power plant for Dominica by the end of next year. You may access the news on our YouTube channel. On behalf of the production team, I am Julian Morris. Thank you for watching. Join us tomorrow.